Hi, folks. Hey, did you know that one out of two Americans has high blood pressure? So, what exactly is blood pressure? Let's talk about it. So, blood pressure is the pressure that's exerted against the walls of your arteries, and there's a top number and a bottom number. So the top number is called the systolic blood pressure. The bottom number is called the diastolic. The top number is how much pressure is being pushed out or exerted against the walls of your arteries when your heart beats. The bottom number, diastolic, is how much pressure is exerted against the walls of the arteries in between heartbeats. For years, we have said that a normal blood pressure level is 120 over 80, but that is being debated now. Some people think that a better blood pressure might be 110 over 70. So when your blood pressure is consistently above normal, then we call it hypertension. Again, one out of two Americans have hypertension. The higher your blood pressure level is, the more risk you have of developing certain conditions like heart disease, a heart attack, or even a stroke. So, what are the signs and symptoms of having high blood pressure? Well, unfortunately, there really aren't any signs or symptoms. That's why we call it the silent killer. People may have high blood pressure and not have any idea that it's there. What causes high blood pressure? Oftentimes, it has more to do with lifestyle choices, not getting enough physical activity, maybe being overweight. Diabetes can cause it for sure. So, what happens if you do have high blood pressure? We see it all the time in our clinical setting. People who have heart disease, who've had a heart attack, people who've had a stroke or other kinds of brain issues, or even kidney damage can occur from having high blood pressure. So, really, the only way to know if you have high blood pressure is to check it. Obviously, a healthcare provider would be more than happy to check your blood pressure. In fact, it's typically part of a routine office visit for screening, but you can check it yourself too with the proper equipment. Spending 20, 30, $40 will get you a good machine that can give you fairly accurate readings. So, what can you do to prevent high blood pressure? Well, first of all, definitely don't want to smoke. That's a risk factor for high blood pressure. Do your best at achieving and maintaining a healthy weight. Manage your stress the best that you can. Eat a healthy diet and limit the amount of salt in your diet for sure. And alcohol is a big factor in causing high blood pressure. You need at least 150 minutes of physical activity every week, which is about 30 minutes a day, 5 days a week. So there you go. That tells you a little bit more about what high blood pressure is all about, what hypertension is all about, and what you can do to prevent it. If you find that you do have high blood pressure, the very first thing is to make those lifestyle modifications. But if it's high enough, you may need to be on medication. So talk to your healthcare provider about that.